Happy National Rural Health Week to everyone. And we are definitely celebrating it today with this awesome event here in New Jersey with our third annual Rural Oral Health Conference. So on behalf of the DOH and Commissioner Persicelli and again, Nashon, who's the Assistant Commissioner for Division of Community Health, and our offices of primary care, who you've met, Dr. Tyrell, and then also our Oral Health Services Unit. As State Dental Director, we welcome you all to New Jersey. We welcome you here. So we have definitely a diverse number of people in attendance today that have, and we've had the opportunity to disseminate the event so that many people, not only here in New Jersey, but throughout the country, could join us and be included. So it's very fitting that, that today's theme is right on target. The theme of diversity and inclusion and addressing the needs of marginalized populations in rural communities. So rural oral health matters, right? It matters. But why does it matter? Why does it matter? You all probably have heard this before. It matters because you're not healthy without good oral health. Again, you're not healthy without good oral health. So let that sink in, but also let's be reminded of some of the components of oral health as it relates to some barriers and some issues that people who are in rural communities are subjected to. We have, as mentioned earlier, some issues with regards to income, food, their environment, education can be a barrier, transportation, housing, but also community infrastructure. And that word community is an important one for many reasons. And I want to focus on that because it's kind of like a theme that we are creating here within oral health services, but also as we collaborate with others in the community to get some of this important work done, right? So we're gathering today here as a community of oral health champions who are exploring and implementing ways that we can improve oral health here in New Jersey. Many of you that are participating in today's conference are also contributing to an effort, contributing with your time, your passion, and your expertise as a community of key informants and stakeholders that are working hard to help us develop New Jersey's first ever state oral health plan. This strategic plan will set forward a roadmap for all of us as a community of oral health champions to follow as we seek to improve oral health access and overall oral health care for all of New Jersey's residents. Also, the residents in New Jersey, we are dispersed in various communities throughout the state, both in urban, suburban, and rural areas. Also, many, if not all, the residents in these communities have one of these, right? Have a mouth. But unfortunately, some of them do not have a voice. Some of them do not have all of their teeth. Some of them are not free from dental disease. Some do not have a dentist or a dental home. Some don't even have the confidence to speak or to be seen in public due to missing teeth or poor oral health. And some don't even have the understanding on how their chronic illnesses and diseases like diabetes, heart disease, and being on medications that can dry out their mouths can actually affect their overall oral health conditions. So that's key to know, but also some don't even have the realization that oral health is a key part of overall health. And this was something that was said by one of our colleagues, Dr. Jastrow. Oral health is a key part of overall health. In a recent interview, Dr. Jastrow shared, she's actually the new advisor to the director of the National Institute of Dental, Craniofacial Research. And she, in the interview, she stated that it's really, of course, important to educate the public on how good oral health is essential to good overall health. And also she that, we have the opportunity as a community to communicate and bring together a whole health view and engage the public and the healthcare systems around this particular topic. There's a new NIDCR report that's coming out, Oral Health in America, Advantages and Challenges. And this report will give the agency a chance to accelerate the translation of currently available data and science into practice, into policies and behaviors to improve the health of the public at an individual, at a family, at a national, global, but also at a community level. Community level. Some other things that we know about our community in New Jersey is that, unfortunately, less than 16% of our residents have access to community fluoridated water. We also have some ongoing challenges regarding recruiting providers to provide their expertise in some of the dental health professional shortage areas, and also throughout some of the FQHCs as well. We also know that geographic isolation also lends to longer travel times, which can also be a barrier. And then also a barrier is for some providers is the fact that reimbursement is low for some of these procedures. We also know through some past history and some also reports on rural health needs here in New Jersey that, of course, tooth decay and poor oral health is an issue. And we know that cavities are rampant or have been rampant, and there needs to be community water fluoridation. At least that's what one of the providers said when surveyed doing this particular report. And of course, there's recommendations, and one of the recommendations from the report was, of course, have some policy change to increase provider reimbursement and to fluoridate more of the water sources here in the state. We also know that, again, dental care has accessibility issues, and it's one of two of the most pressing issues from the study. And then dentistry is one of the two most requested specialty care where people are having access to care issues as well. And we talked, some of the other speakers shared with you some of the uniqueness surrounding New Jersey as far as our rural designation. And we also know that at times zip code can be an issue, right? It's a stronger prediction of oral health care outcomes more so than genetic code. And that's definitely the case for the rural communities that have those zip codes as well. So what's next? What's on the horizon? What's going to be happening? What do we need to do in 2022 and moving forward and beyond? Well, one of the ways that we're going to continue to move beyond is based on the work that our FQHCs are doing. And fortunately, we have just a robust number of those, especially those that are in rural areas, as Dr. Tyro mentioned, and I may have tried to sneak on a couple of other of the centers on here, but all in all, shout out to the FQHCs here in New Jersey. You guys continue to do amazing work, and especially in oral healthcare as well. So we want to continue those opportunities for our FQHCs to shine and to really reach into this community, right? But we also have some actions that need to be taken or at least explored, right? And those actions are going to change things here in New Jersey. So what's the action? Well, as quoted, we must seize this unprecedented opportunity to ensure that the mouth becomes reconnected to the rest of the body and health policies, and then also in programs. So policy and programs and policies. And one of the most long-lasting programs that we have here in New Jersey related to oral health is the Children's Oral Health Program, which continues to reach all aspects of the state, north, central, south, rural, urban, suburban. And moving forward, we want to continue to make sure that there's that residents throughout all the communities have access, or at least have information that allows them to have access to being able to identify where the help is, where the oral help is. So,
Dr. Hayes, I'm sorry, just to remind you, you have 1 minute left.
Thank you. So this is one opportunity that we're going to continue to make sure that is outsourced as an action step. We are in our phase 2 of New Jersey's first ever state oral health plan. We are at the phase where we've already have identified some priorities: access to care, medical dental integration, state funding allocation that's dedicated to oral health, and oral health equity and culturally competent practices. Those are 4 priorities that we're going to be continuing to concentrate on as we develop this plan. Teledentistry is a future topic that's going to continue to be among us and also impact rural communities. We know there's issues with regards to broadband. There's state board regulations and funding for the activity so it can be sustained, but it is a topic that we should continue to look at. Mobile mouth ministers, being able to go out into the communities, go into people's homes, but also where people are, whether it be their homes, their church, their community center as well, is important. And then we also have the ongoing need for workforce and being able to collaborate with different models, community health workers, dental community health workers. We have a new Community Health Worker Institute through the DOH as well. And that's also an action step as well. So as I wrap up, thank you for the reminder about time. There's just so much going on. I just don't have time to talk about, but again, the notion of community is important. Continue to remember that because oral health is part of each of us as individuals and our families, but also importantly for our community. So please continue in our efforts to make sure that oral health is advocated for as an integral part of overall health. But don't forget the fact that we also need to advocate for oral health in the medical community, in the nursing community, in the behavioral health community, and also the public policy committee. So that's my time. Thank you so much. And remember, we here in New Jersey are counting on all of you so we can get this important work done. Thank you.